New research has shown that COVID-19 is affecting patients' digestive system long after they're recovered from the virus. What began as a respiratory-focused virus has now evolved to other parts of the body, with the virus rapidly multiplying and affecting or spreading through the GI tract. Katie Jensen spoke with Dr. Majidah Bukhari, a consultant gastroenterologist at American Hospital Dubai, to find out more.
Before, we thought that this is only respiratory virus that is not affecting the gut. But as a pandemic actually evolved, we've noticed that it's affecting the GI. The question is why this virus affecting the GI tract. So we actually found that the virus is attached to the specific receptor called AC inhibitor or AC enzyme. The virus is attached and then entering the cell inside the GI tract and replicate and causing the problem. So some people actually, they may have only GI symptoms as manifestations of COVID, or they have first manifestation of COVID as a GI symptoms. So those people will present with either anorexia, loss of appetite, loss of smell. They also have diarrhea or vomiting. So we really have to watch these people when they present with this GI symptom.
So are you saying that for some of your patients, they didn't actually know they had COVID, that the first symptoms they were having were digestive problems?
Yes, there are some people, they only present with the GI symptoms without any respiratory symptoms.
So can GI manifestations be a red flag that there's something more severe going on in different parts of the body?
Yes, so COVID is actually affecting a lot of systems, not only the respiratory and not only the GI, it's affecting even the heart, the kidney. So, and we are actually seeing that some people with the COVID, they may present with the bleeding because the virus has actually caused thrombosis and can present with also a GI bleeding.
So what are the main symptoms to look out for? How do we know the difference between just feeling a bit off one day and actually there's something really wrong?
So sometimes it's very difficult to point. You know that the COVID is still like new. It's very difficult to know that this is most likely COVID, but we usually have to see a patient in a person, evaluate them, take the full history, examine them to make sure that they don't have, because between COVID and other diseases, there is actually sometimes it's overlap, so we cannot point to one disease over the other. So evaluation of the patients is very important. But if anyone presenting with weight loss, anorexia, blood, they have to come to us and being evaluated just to make sure that they don't have a serious issue in their gut.
So what kind of treatments are typically on offer? Is it quite simple to fix, or does it require a more cohesive approach?
We usually have to evaluate them as multidisciplinary team approach. They have to see different specialty, including behavioral, dietitian, gastroenterologist, and respiratory specialist to treat them as a team. Those people, we always recommend them to drink enough water, 2 to 3 liters. They try to eat healthy, avoid any processed food. We always advise the patient to sleep well and try to minimize their anxiety, because we know that we went through this COVID and we know it's very frustrating disease, unfortunately.